Hi, Dr. Magdalene Kerschner from Victory Wellness and Medspa. And we're going to talk about a little bit today about bioidentical hormone replacement for women. So first, let's say, what are these bioidentical hormones? Many women come in, they're confused. Oh, my doctor told me hormones are so bad for me that I should just take antidepressants. And so I just want to clarify that there are bioidentical hormones and there are synthetic hormones. Synthetic hormones, which are drugs that are hormone-like Premarin, Prempro, that are manufactured by drug companies. Those drugs have been associated with a lot of toxicity, breast cancer, strokes, and heart attacks. There were studies done in 2002 confirming that synthetic, especially progesterone, like Depo-Provera, is extremely toxic to the human body. So no, I certainly don't recommend that. I wouldn't take it myself, and I do recommend though bioidentical hormones, which I have taken for many, many years now, and I found them to be extremely beneficial. Bioidentical hormones, the reason they're good for us because they're made through a DNA recombinant technology, and they're identical to the hormones that our own body, our ovaries, produce. So therefore, they undergo the metabolism of our natural hormone, and they're not toxic to our body, as opposed to synthetic hormones that have metabolites and they undergo different metabolic pathways and become toxic. So that's the big difference with hormones. So I just want to clarify that because there's a lot of women that are very confused. They desire hormone therapy because they're miserable, but they're afraid to try because they're confused about what hormones do to our body. So typically what happens to us as we age, premenopause, it probably starts in our 40s, the menopause where it's all shuts down. But we find ourselves, of course, very fatigued. Partially it's because hormonal drop. Another reason is we don't sleep at night. I think any woman has experienced that after about 45, what happens that either we can get to sleep, or worse yet, we wake up at 3 in the morning and we're up for 3 hours. Our mind are racing and we can't get to sleep. Then we fall asleep. Then the alarm rings. We're up. And we're cranky, tired, dissatisfied. I remember when that happened to me and I was blaming my husband, I was blaming the kids. And that's when I received bioidentical progesterone from my OBGYN for a different problem. My amazement was I started to sleep. I said, this is a miracle drug. Not enough that it helped my other problems, but it also made me go back to sleep. And I realized, oh my gosh, there's something more to all these hormones. So women also experience vaginal dryness, inability to have intercourse, decreased sensitivity with intercourse, meaning we're not enjoying ourselves anymore as much as we used to. So of course it doesn't become something we really want to do. There isn't that much benefit for us to participate in that activity. So there are some marriages that are at stake because of that, or just dissatisfaction with the quality of life, for both man and a woman in a relationship, of course. So when we weight gain, of course, as our hormones drop, as we become more insulin resistant with age, we lose our testosterone that speeds up metabolism. We experience weight gain. I think almost all women have experienced that after 45. I have not changed my eating habits and I'm piling on weight. So doing bioidentical hormone replacement, replacing the hormones, what it does, it puts our body in a mode of a younger version of ourselves. That means our metabolism speeds up, we have easier time losing weight, we have easier time staying lost, just like when we were younger. There's also issue with thyroid. There are a lot of people out there, especially women, walking around being mildly hypothyroid or subclinically hypothyroid, yet thyroid is a major hormone that is an engine of our body. It processes calories. So if that's slow, if that doesn't have enough oomph and gas, we're not going to burn those calories. So it doesn't matter how much we diet. Our body's working against us all the time. And I see this all the time, so I do recommend for women, especially women after 45, is to consider hormone replacement to put their body in a younger version mode of themselves. And of course, I mentioned already fatigue, hot flashes, nights, which are classical symptoms of menopause that women experience, are very troublesome. I've had professional women desiring hormone replacement because they said they're in an executive meeting and their suit is wet. They start sweating. And that's not something that's really acceptable in the boardroom yet. or maybe it is, but it's still very embarrassing for a woman. So that's or if women have told me they have to switch their pajamas 5 times in one night. Obviously you're not going to get any sleep living like that either. So that is a big reason why many women seek relief, and many of them do not know that relief is possible. Typically what women tell me when they go to their primary care doctors, they're offered antidepressants, or they offered for fatigue stimulants like Adderall, that actually makes them feel even worse because it is not treating the root cause of their problem, which is hormone deficiency. We cannot treat hormone deficiency with antidepressant or Adderall. It actually compounds the problem, causes side effects. It's very bad for our health, and makes us even more miserable and creates a whole new set of problems. So I invite anybody who's feeling some of these things that I talked about, who's not feeling herself, who's exhausted, sleepless, and sexless, I could say, to come in and visit me and for a free consultation and consider bioidentical hormone replacement.